Hey there, it's Dr. Cammisa. Welcome back to our video series, and today I'm really excited about getting into some meat and potatoes here with shockwave therapy. It's part 2 of our video. Well, really not meat and potatoes. If it was up to me, it'd be like just more pizza. I love pizza. So anyways, I don't know where that has to do with anything, but today we're talking about neck pain and shockwave. So if you're new to us, please subscribe, hit the little like button, turn on your bell notifications there, share us with your friends. And so stay tuned. I've got lots to share about this. This is going to be a really great one. If you're suffering from neck pain or know someone with neck pain, you want to share this video with them. So stay tuned. Hey there, welcome back. So today's topic is going to be neck pain and how do we deal with neck pain and how can shockwave therapy help neck pain here. And so what I'm going to do, I'm going to break this down into some different segments here, but I really want to start off by saying when we talk about neck pain, here's what we get. We get people that call in, come and see us for consults, new patients, and tell me if this doesn't sound familiar. Oh, I've had MRIs, I've had all kinds of x-rays, I've had all kinds of studies before, I've had EMGs done before, I've gone to every doctor there is, I've had pain injections before, they still can't figure out what's wrong with me, but here's all my information, here's my discs, here's all my data. Sound familiar? Yeah, we get that all the time. At least once a week we get a case like that, whether it's low back or neck, but today we're talking about neck pain, where they have exhausted everything, truly exhausted everything, quote unquote, exhausted their knowledge of care based on being inside the medical box. Well, if any of you know us, we're definitely not inside the box. We're outside. There's no box with us. We are on the frontier of trying to help people, empower people to live their best day every day. So when it comes to neck pain, I'm going to break this down so you see just how we analyze and how we deal with neck pain and why our approach. And now we've added this incredible therapy of shockwave. So when there's damage to the neck, when there's damage to ligaments, when there's damage to the tissue because of traumas that have incurred over the course of time, then this is our first line of defense. And I'm going to explain to you how we actually go about that. So when we see a patient with neck pain, we often, if they've been around seeking different types of care before, whether that's different medications, whether it's pain injections, whether it's PT, whether it's another chiropractor, whether it's they've had MRI, they've had CT scan, they've had x-rays before, they come in with this booklet of information. And when I see people come, we usually get this about once a week, where we see someone bring in, they've got a binder of information. And they're looking for answers because no one has found it yet. And I like to ask 2 questions. Why do you have the pain and where's it coming from? If we can answer those 2 questions, then we have a really good chance at resolving the issues that are causing the pain. So when it comes to the spine, when it comes to the neck itself, it's a complex moving device. There's lots of moving parts here. And the best way to understand that, to understand the biomechanics and where you're having issues, is to look at a detailed analysis of the x-ray. And so we use a system called Postural. I'm going to insert a video clip here that we did in the past on extensive detail on analyzing the cervical spine, to locating where the damaged tissue is, why are they having pain, where's the damage, what segments are moving too much or not enough. So that's what's going to play here. Okay, so now we've got the x-ray on this side, but now we've got the data that we get from digitizing the x-ray. And so the data points out, and that's why I have these two areas highlighted, C4, C5, and C5, C6. You can actually see them here. I circled them in red, and you'll probably get a better picture of this on the video. But I circled these in red here. We said that she had lost 90% of her normal curve, and she's 30 millimeters forward. So that's over an inch forward, meaning that as my head goes forward, it puts stress. So when we talk about individual vertebrae or whole sections of spine getting shifted, and that shift is like a dimmer switch, it puts stress on that spinal cord. Well, we have actually two things happening here. We actually have individual segments that have been shifted out of place due to injury, and then we have here this whole head is shifted forward. So this particular person is getting a double whammy from individual vertebrae and from the shifting. So when we analyze this, there's just a tremendous amount of data just in this picture itself. So now I'm going to show you what we actually do. We actually have the patient actually bend their head forwards, bend their head backwards, and then we look at that data to find out how their neck responds when we move. Because when we're having, like for example, if we have an MRI or a CAT scan and they're laying down, they're strapped in, they don't move. But when we live our life, we're always moving around. So we want to find out, is there an instability? Is there any part of the spine that is unstable in any direction? All right, so now what you can see here is we actually have two different, so this is on this film on the right here, we have them bending their head forward, bending their head backwards, and again, same x-rays, bending their head backwards, bending their head forwards. And so what the software is doing is actually analyzing that motion in two different ways, just to make sure that we don't miss something. So this is a flexion extension studies. We do this a lot for any type of neck case. We do this film for whiplash cases, traumas, concussions. We want to find out if there's any instabilities. And where there's red lines here, whether it's this analysis, or on these two here, the red lines indicate that those joints are actually moving too far. So now I'm going to bring out the data and show you what's actually happening now. All right, well now you can see that we still have that flexion extension series on the left here. And now we brought up the data sheet that goes with this. So every x-ray we take has an actual data sheet. I don't go over this with patients. This is just all information. The goal is, this is for us to understand, is it a flexion injury, meaning that they maybe took a somersault and injured their head? Is an extension injury, were they walking and did a face plant on a table or something like that? So, and what we're seeing here, I said initially that the red lines indicate joints, hypermobilities, joints that actually move too far. It's like a hinge that you have one hinge that doesn't move enough and some that move too much. Well, this is showing us here that in the circles, when she bends her head backwards, we have this C2, C3 right here that is moving too much, and it's moving too much because it's in the actual numbers in red, not that it's just highlighted in red or circled in red, but it's actually highlighted in red because that's past the AMA guidelines for how much a joint can actually move. And then that C5, 6 again, that was the initial injury area. is highlighted again, meaning it's moving too much in flexion. And then when we look at how those joints actually move overall, how much is a joint moving when it goes forward to backwards? Are they all moving about the same? Well, when we look here, we see, if we look at these, some of these numbers, 21, 13, 28, those are fairly high numbers. And then we look at the ones that are circled in blue. We have a 5 and a 7. And so that tells us we have 3 segments that are working too much, and then 2 segments that aren't working enough. And so it tells us that no matter what this person is doing, their biomechanics is off. It's kind of like you're driving the car, you're going straight, but that wheel's turned. So now we know where the neck is not moving properly, moving too much, not enough, whether the neck is rotated, if it's tilted, whatever the situation is. So we want to address the joints, the nerves, the muscles, the ligaments, the tendons. We want to stimulate all those different tissues. And so the Shockwave unit comes with different, we talked about this in the previous video, the Shockwave unit comes with different attachments that it is going to control how deep that energy is getting into the tissue. So these are just some of the different tips that we have, different transmitters that we use depending on what we're trying to accomplish and what part of the spine that we're working on. And so you're going to see a couple pictures of the different tips. So if we have, for example, if we're trying to work on the actual joint themselves and stimulate the ligaments around that joint, you're going to see what that picture looks like. If we're trying to work up here into the suboccipital area, which is all the base of the skull, which moves the first 2 vertebrae, the C1 and C2, or atlas and axis, where you're going to see some pictures there. You're going to see some pictures right here where that red area is here. That's for the sternocleidomastoid muscle, the SCM muscle. We can actually work in there. You're going to see a picture of, there's the C1 right here, right? That's what the skull sits on, is C1. It's a ring that can rotate, and the rotation can cause pain and discomfort. So we can actually get into this tissue here, right? And then after we do all the muscle tissue, the ligaments, the stimulating the suboccipital area, then we get into working with the joints. Now, does that look a little similar to my adjustment instrument? It certainly does. It's talking about frequencies. We know this works on a frequency. This works on a frequency. We know that this works on different forces. We know that this works with different intensities from the air compression. And with the different tips, we can generate different depths of penetration. And so when we're working on the spine, we're going to do all the Shockwave therapies first, and then we're going to come by and we're going to actually adjust the spine afterwards, because this is going to tell us in real time feedback of how that spine is actually moving. We're trying to decrease the pain. We're trying to increase blood flow. We're trying to get those joints to move properly. And we're trying to improve the healing of the tissue. And so what happens after we do that treatment, those treatments are done usually 5 to 7 days apart, so we like to say about once a week. So if you're having neck pain, that first day you could feel really good, like we've just injected WD-40 into that neck. It moves easier. There's no pain. And then the next couple days could be discomfort as those tissues are starting to heal. It could take 5 to 7 days for those tissues to heal. Hence why we do it once a week, During that time frame, I don't want you to take any kind of ice or ibuprofen. You want to let the tissues just heal on their own. And depending, our first series of treatments with this is done for once a week over a 6-week period of time. Now, like I said earlier, it depends on what condition we're starting with, but we're going to want to re-x-ray to see how those joints have improved their range of motion, how some of those joints have tightened up and become better balanced. So our software system allows us to run these comparative reports to show us, oh yeah, that injury at C4, C5 is actually getting a lot better. Let's look at the reports. Let's look at the data to show, oh yeah. And by the time we see a structural change, you're already feeling better. You're already feeling like you're sleeping better. You're able to do more things with your neck. You're able to work longer at the computer. Maybe you're able to bake longer, or whatever your hobbies are or passions are. So, but we do have data to actually be able to measure the changes. So after we determine that there is improvement in the function of your neck, and there is going to be improvement in the function of the neck because we're changing the structure of your neck. Don't forget, we are working on the joints, the ligaments, the tendons, the muscles, the nerve tissue. We're affecting everything. So if structure governs function and we're changing the structure, then we're going to change the function. And that's what we're really about long term, is if we're going to empower you to live your best day every day, we can't just get rid of pain for a little while. We've got to change how your spine functions so that you can live your life and do the things you want to do, whatever that may be. So once again, here we are. We've brought a new technology into the clinic, this amazing shockwave therapy, which is our first line of defense for regenerative work on the spine and the tissue. But we just don't use shockwave by itself. We obviously use our instrument adjusting device to test in real time to see, okay, how is the spine actually responding? We actually use postural X-ray analysis to measure exactly where the problem is. So we're combining and using these different technologies to dual gun. I could have been a cowboy. Maybe not. Just a little, I just thought about that. Anyways, we're using as much technology as we can to empower you to live your best day every day. So if you have neck pain, or you know someone with neck pain, please share this video with them. Have them give us a call. Like our videos. So until next time, have yourself a fantastic day. God bless you. And until next time, we'll see you later.